Hi, my name is Shannon, and I'm a recovering alcoholic and addict. In the end of my addiction, it was the heroin that brought me to my knees.
My name is Michael Bassett, and when I was 5, my mom's boyfriend started to do domestic violence. I remember him beating her very violently and her yelling for help.
I had a mammogram that didn't turn out too well. I had I think they called it a radical mastectomy, because I am totally blind and unable to navigate the system by myself. Getting from appointment to appointment was very difficult.
My parents from Burundi. I was born to a refugee camp in Tanzania. My parents was tell us story, was war, was fight, just hungry, no food there. Because doctors was speak English, I don't have English, was just my language, was so hard.
I'm Anthony. My grandfather died when he was 55 years old of a heart attack, and I never got to know him. I would go into my doctor's office and we would talk about how in 10 years I might have a heart attack. And I wanted to make a change.
So my name is Alexis Ortiz and I live in Roxbury, Massachusetts. Freshman year, I wasn't really into school. Like, I was there, but I didn't want to be there. Doing the STEM program was really a life changer for me.
The Center for Community Health Improvement partners with underserved communities to make measurable improvements in some of the tough public health issues. Issues like reducing substance abuse, preventing violence, tackling the obesity epidemic, exposing young people to opportunities in health and science, early detection of cancer, and increasing access to care for vulnerable populations.
Community health is such an important part of the mission because it's part of our DNA. We were founded in 1811 to care for the poor people of this region, and we certainly are very good at rescuing people, and be they suffering from cancer or heart disease, but I think we also have a responsibility to go upstream and try to address some of the social factors that cause those problems in the first place. And through our community health mission and activities and through the Center for Community Health Improvement, that's exactly what we're doing.
We partner with local communities to change those conditions. For example, our Healthy Chelsea and Revere on the Move coalitions make healthy food and physical activity easier choices to make. They've successfully advocated for things like walking trails, community gardens, and farmers markets. Why do we do this work? Because it's not only our job to treat people when they're sick, but also to prevent illness in the first place. Our goal is to improve outcomes for patients and communities and to reduce healthcare costs. Prevention is a vital part of both strategies.
So I've been clean and sober for 9 years. I do use a lot of the tools that I learned when I was in treatment to help the folks in my community who struggle or in the grips of addiction.
The substance abuse problem in this community reached really epidemic proportions in the early 2000s, and the community was completely devastated. We were losing an entire generation of young people.
So she can't go to a traditional detox.
The Charlestown Substance Abuse Coalition takes on a very different tact in trying to address the substance abuse problem. We've designed prevention curriculums that go into the school systems. We've enhanced public safety by advocating for more police officers on the street. Engaging members of the community in such a way that they feel empowered to have an impact on a major public health concern in their neighborhood. Shannon Lundy has lived the life of an addict. It devastated her world, and she is now a role model for every young person in this community.
And then a neighbor called the police, and I remember 4 police officers and Georgia Green coming to the house. What she said to me, it made me feel like secure, like it made me feel like nothing was gonna happen again.
Violence is a big issue in Chelsea. And I think that the program that we provide and the service we provide really helps parents of children who are traumatized and the children themselves move through it much more quickly.
The experience that I seen when I was 5 made me want to think about a career in law enforcement so I can help those kids like I got help when I was 5.
Yasmin is not just my navigator, but she's become my friend.
I help patients that have abnormal findings go through their diagnostic appointments.
And when I didn't understand medical terms, she helped me. And to be honest, if this program didn't exist, I probably wouldn't have gotten the treatment.
She helped me to find Medicare or to find my doctors, children doctor or my parents doctors, to read letters, to have appointment.
Around 44% of people living in Chelsea are foreign born. 67% speak another language. They come here, they don't speak the language, they don't understand the healthcare system. They are asked to integrate in the culture. MGH mainly help the family continue having access to care.
I wanted to make a change, but it was just difficult on my own to understand how to change. And then Revere Cares, Revere on the Move, this Mass General program was that opportunity for me to make change that was sustainable to me.
To combat obesity, in Revere Cares, we've partnered with the city and brought together the Revere on the Move Task Force. Together we study the community, we learn about its assets and resources and its needs. We then work with the community to identify its priorities around obesity, and we aim to make permanent and sustainable changes, like this community garden.
Doing this program was really a life changer for me because when I was in freshman year, I wasn't really into school. Like I was there, but I didn't want to be there. But when I got into the program, I had a motivation in my life.
So we expose kids from 3rd grade all the way through college to science and to opportunities as they get older and are teenagers to having jobs here at the hospital.
He was entrusted with stocking and restocking of various critical care carts. Solid job that he performs makes a huge difference, and in some cases the difference between life and death.
We've seen a 64% reduction in overdose rates since when we started, and I think it's a 42% decrease in mortality rates from opiate overdoses.
But your program really helped me.
Oh,
Thanks,
so
Georgia.
good to hear that.
Thanks so much.
Yes, this program is really invaluable. It saved my life, basically.
Shanta, she's like my family because she helped us.
I've lost over 35 pounds, and I directly attribute that to my participation in the Citywide Fitness Challenge. I have been given the tools and the opportunity to make a difference in my life, to change my life, and that I've changed my path. I've changed my health outcome.
It gave me a lot of confidence because it showed me that no matter where I go in life, if I work hard, no matter what anybody says, I'll be able to succeed.